Hi everyone, we are now in our skills lab, and this is a place where we practice things like medication administration, catheters, NG tubes, injections, and all sorts of fun stuff. We have 16 bays here, and that's where we do a lot of our hands-on activities and do a lot of your learning so that when you get to the simulation side, you have all the skills you need to care for our patients. So my favorite part about simulation is how independent we are as student nurses in this setting. We really practice as the RN on the case, and we treat our patients as if they're our own. Another great thing about simulation is it may seem odd that we're practicing with mannequins, but once you step through that door, it really does feel like you're in a hospital room and you're working with a real life patient. It's a great way to see how you react in high stress environments and build teamwork with your peer who you come into simulation with. We even have a phone in here that we can interact with the doctor or the pharmacist if we need to. So it's really a great place to do a lot of learning, and it's one of my favorite places to be on campus.
All right, welcome to our debriefing space. So this is the space that our students, as they enter the Simulated Health Center for simulation, they'll come and meet in here right before we begin. And so we gather in here in small groups. Our groups are usually no more than 6 students, maybe 8 at the most. And we come in here and prep the students in what we call a pre-brief. So we talk to them about what they can expect for their time when they're here. We talk about psychological safety and really establishing that safety here, that we want them to feel like they can make mistakes and it's okay, and we'll talk through it. And so we talk a lot about that. We also prep them for the case that they've prepared for. So they come prepared usually for a specific patient that they were able to look at online prior the night before or the morning of, and we start to plan care for that patient as a team. And so we're really able to hit home on a lot of teamwork aspects in that, because we really utilize that time to plan care for that patient as a team. And then what we do is we send students in pairs to go visit the patient. And while that's happening, like if Kate were to be going next, she would go in with her peer and they would go in and care for a patient. And we would actually observe up on the screen, just like that other faculty would be observing in the control room and controlling any changes. And so I'm in close communication with the faculty that is in the back, and we're talking about if we need to make any changes based on what Kate and her peer are doing. Maybe we need to adjust something based on something that they implemented. And so the peers are able to come in here and they're able to observe and see what their colleagues are doing. And then when they come back, they can provide feedback. And so they'll be in the room typically anywhere between 15 and 25 minutes, and then they'll come back in here and we'll do our debrief. All right, this is one of 6 exam rooms that we have on the ambulatory care side of our Simulated Health Center. So as you can see, we've just got a typical clinic room set up in these. And so we've got 6 duplications of these. They are also equipped with cameras and audio as well, so that we can observe and watch students as they enter. All right, this is one of our simulated apartments that we have. This is our main simulated apartment that we utilize. It's really utilized just for an apartment space. We really want our students to be exposed to different kinds of nursing. So not just in the typical hospital nursing that they might see on television, but there's a whole world of nursing out there in the communities, and we really want our students to be exposed to those areas. And so this really allows us to do that. And then we're able to convert some of our acute care rooms to apartments as well when we need additional ones. But this is our main one, and so it's got a little mini kitchen over in the corner. We've got just kind of your basic living room set up in a dining room, and then we have plenty of props that we'll bring in. And so we might bring in food props, beverage props. We might have maybe different trip hazards that we have that we want the students, safety concerns that we might want them to see in here. And these are all set up with cameras and audios in all of the rooms as well, so that we can do just what we do with our acute care rooms when we observe and do debriefing. We're also slowly starting to incorporate a lot of that higher technology. We have an Alexa in here, we have a Bluetooth scale that the patient might use, and so really trying to bring some of those up and coming technology that they might be exposed to out in the community.